This video demonstrates the DMEK donor tissue preparation technique used at our institution. The corneoscleral button is placed on a Teflon block. A 30-gauge needle is used on a 1 cc syringe filled with Optisol to enter the peripheral rim through the sclera. A superficial plane is found close to Descemet's membrane, and a gentle injection of the solution is performed. Formation of a blister consisting of Descemet's membrane and endothelium can be observed. The injection is performed in a gentle but determined manner. Using the 30-gauge needle, the blister is pierced and the opening extended circumferentially to the limbus. The blister is drained using a surgical spear. A few drops of vision blue are used to better visualize the opening. Excess vision blue is gently rinsed. Corneal scissors are introduced in the space and the tissue is cut for approximately 180 degrees. The tissue is folded over using balanced salt solution or a spatula. Calipers are used to confirm an 8 mm area. A 2 mm skin punch is used to trephinate the corneal stroma. The tissue is replaced in its position with balanced salt solution and the edge is dried. The tissue at this point can then be replaced into its original container in Optisol for later use, or the preparation can continue on. Once ready to use, the corneoscleral rim is placed epithelium side up and the punched stroma is removed, revealing a 2 mm window into the anterior Descemet's membrane. The well is carefully and repeatedly dried to allow proper placement of a letter F to be used as a reference mark during surgery. The tissue is then placed endothelium side up on the Teflon block. Balanced salt solution is used to ensure proper positioning, and a caliper set at 8 mm is used to confirm the size of the graft. The tissue is then flooded with vision blue for approximately 60 seconds. An 8 mm trephine is used to tap the Descemet's membrane and endothelium complex, avoiding forceful tapping that could potentially punch into the stroma. The tissue is gently irrigated and a surgical spear is used to ensure proper visualization of the tissue. The inserter used is a Medicel injector without the spring in the plunger. The cartridge is filled with balanced salt solution and the plunger is then advanced onto the opening to produce a hermetic seal. The tissue is then grasped with toothless forceps and loaded onto an intraocular lens cartridge. The DMEK graft is then ready for insertion.